Hi, welcome to Detours Understanding Acquired Brain Injury. And with us, we have, as you've seen before, Sarah. Um, you've seen her before, and as you know, she's a physician and with brain injury. And one of the reasons she's here is to help explain a little bit about what um, some of the training that physicians get in relation to brain injury or don't get. This has been a question that's been asked a lot. So, hi, Sarah.
Thanks for you.
Yeah, yeah. They really taught nothing, huh?
Yeah, I think it's fun to we learned that in
Oh,
kind of give some insight into treating um, certain brain injuries because you would have an idea, but usually they're irrelated. Like they're different areas, and then residency so far. So I even did neurology for 2 of them, so I spent 2 months, and you learn according to the patients that you get. And so, no, I didn't have any, TBI patients. Unless you consider stroke a brain injury, which it is.
it is. It is an acquired brain injury.
Trauma. So yeah, I say rotation. So you learn, kind of the basics, but you don't dive deep like I would have liked to. And I did research on my own in order to best be able to understand these patients. But yeah, it's not something I'm a psych resident, so it's not something that psych residents are usually taught to. And I can't really speak for like and your family practice doctor as far as that goes, but I believe they get one. And so and you only learn it at
And that's just that is one of the things when I was looking through like a list. It's the one guy I talked to in med school. He said he got for all of his neurology, he got 3 weeks. Kate has said and has said this before. She got like four total all together throughout her entire med school education, like and residency all together 4 weeks. And she said it did not prepare her for she said even the anatomy and phys she got for the brain was like rather poor.
neurology and psychiatry.
Mhm. I mean, for anyone who has a deep abiding passion, yeah, I mean, if this is your jam, I mean, heck, you can then go for brain injury medicine as a subspecialty, whether you're a physiatrist, a neurologist, or a psychiatrist. But unless this is your jam, and very few people do choose that as their subspecialty. So, it's like that's the thing that's worrisome because I've had people say, well, my doctor didn't just said, oh, it was just a bump to your head, you're fine. Yeah. So it's like it's mm, Good.
Yeah, it's just, she's a resident.
Yeah. Well, you would know. I mean, and because your own experience, you would be particularly attuned to taking care of psych patients who come in with brain injuries. And like Kate and I had done and had taken a look at like at our hospital what patients, what percentage, and we found around 40% who landed in a hospital had a history of repeat concussions or moderate to severe brain injury. So a lot of docs, family docs, and like PCPs in general, will boot them to the psych hospital when they have neuropsychiatric symptoms, when they should probably be seeing a brain injury medicine doc, or like a. So, right.
We'll just take the patient out even because they're acting in this way. We don't put them on the streets if they're refusing this or refusing that. But no, they're sick.
Yeah.
They're experiencing that. And, there's definitely a possibility of physical implication for their behavior, as well as CT is kind of common in the ER if there is if they know they were in an accident or something like that, and they have damages other places in their body, but it's not used for behavioral symptoms.
No, it's not, and it's typically for.
Definitely, but a physician could be able to kind of have it on be able to detect whether it might be important to do one. And brain injury doesn't necessarily show up on a CT either, but a skull fracture would.
Well, yeah, that was something Kate and I had also talked about. It's like a standard CT scan, like the two of us, Kate and I don't show even on a regular MRI, on a T1 or T2. Um, nope. T2 star or flare, there's some white matter changes that are visible. DTI maybe, but insurance doesn't cover that stuff. Um, and what I know mostly comes from the training I had in clinical neuropsychology. Now, those folks are brain injury experts, but normally need to get referred to one. So your gatekeepers, they've got to know that this person needs a referral and doesn't just need a handful of, like antipsychotic or benzos or antidepressants. Benzos, by the way, are really bad for anyone watching, are bad for TBI survivors, like very bad for us. But it's like they need to know to refer them to a neuropsych. And, it's like that doesn't happen often. And they never get to see a psych or neuro, and many times a family docs, and then they just kind of quit on it.
Yeah.
So, it's like, are you considering getting your brain injury medicine subspecialty if you go through psych? If you're, are you considering it?
If it's available somewhere, sure. I was thinking about
Because God knows that is something that we so desperately need as subspecialists. Right now, it's such a new field. As I've said, they don't even have the test for that. You just have to have the 500 hours of working with. It's just such a new field, and it's like,
patients post concussion, even horrific injuries like some of us have experienced.
yeah,
Concussion and the behavioral symptoms that might come from that, and for families to be able to recognize that and know kid right back in the football game tomorrow. Got it.
that's Blake is an example of how devastating those mild TBIs can be. The CTE. Blake's got a diagnosis of traumatic encephalopathy, and he played football since he was pre-puberty, and the studies show. And so his videos, we talk about CTE and TES as a diagnosis in the living, but he now for concussions, just for those of you watching out there, sports medicine physicians, many of them have started to specialize in doing concussions. Now, they don't do the more severe, and nobody really does long term brain injury stuff. That's again, that falls towards the neuropsychologists, the clinical neuropsychs. And then what happens is they do the diagnosis, the workup, and they'll say yes. And then they say, go back to your neurologist, go to your sports medicine doc. Here's a pack of this. And these are the cognitive exercises. But cognitive rehab, cognitive therapists are not, there's no licensure for them yet. Nothing. Yeah. That's a problem too. There's no licensing or special certifications for a cognitive therapist. Speech and language path, there's no.
Yeah, physical therapists could do.
Yeah, but there's no subspecialties for any of these yet because most of us, I mean, I'm one of those who would have died because I needed a vent for a week. 100 years ago, I would have died. Even 50 years ago, maybe yes, maybe no. Again, those small portable vents were not a thing, and I needed some other procedures and things. So I think that's a big part of it. Is like how I don't know whether you would have died like 100 years. Did you need a vent at all?
No.
Did you need any surgery for needing neurosurge? So 100 years ago, you probably wouldn't have made it. Maybe 50. Yeah, that was something we asked in one of the polls we did, and it's like, I think this is why.
Yeah. Yeah.
All right. Well, so 100 years ago, no. 50, yeah. This is what I'm talking about, and why it's like so troubling to. It is troubling to hear this, and Kate and I, again, something that came up when we were talking about this is like, um, there really are so many missing answers, and hopefully docs like yourself and people who are neuroscientists slash researchers like me, um, we can add at least a little tiny drop of something to this huge ocean that.
Yeah, if you can save one person, help them
I mean, that's what this is all about, is like trying to educate people. I mean, and I appreciate your help, because like, and those of us who are in healthcare, it's like, I've always felt like we're kind of viewed as, if we have a brain injury, we're kind of, disposable. And that's always, so we need to fight for us too.
Yeah. Yeah. That brings more
That we still retain much of our intelligence, if not all of it. We just have some trouble with managing it a little bit. Is there anything you'd like to add or you'd want to tell people regarding doctors, education, that kind of thing?
No, just what you were referring to with the thing, like those were more readily available because even though they just seem like some fun sort of specialty to do or something like so there's so much trauma that happens without like proper diagnoses and treatment plans and everything like that. When it comes to like concussions as well, like there's no awareness there of what needs to happen. So I think making that a more common, more so like the ability to specialize in some of these areas is not really like proposed to physicians and training, and so if that were more out there, even in med school, if that were
Yeah.
if medicine could speak at med school, we would have lectures in med school from outside physicians, but they were just having our or whatever. But like some subspecialties would be really cool.
Yeah, no, that's a good point. It's like I remember like hearing from different people, and it's like, and even in high school that could be useful too. It's like, hey, there are these other things and this is what they do. You don't hear from uh, when Kate was saying, what she was talking about, she said she didn't know what a physiatrist was. And that's because, again, not exposed, because that is not a mainline field, and yet rehabilitation is so critical. And that's a neat specialty. And they're one of those that help in brain injury medicine. But it was a new discipline when she completed med school. And there will be others. There'll probably be regenerative medicine or cybernetics at some point, um, for implants and, that kind of stuff, man machine interface stuff at some point. And so we need to, you're absolutely right. We need to make sure that the young docs are getting exposed to stuff like this and brain injury medicine. Huh.
Yeah.
Work cut out, don't we? Is there anything I can do before we go to help?
You're doing awesome. Keep making the videos.
And thank you for your help. This is a very valuable video. All right, so thanks, and it was great talking to you, and have a good holiday, and I'll see you soon. Bye.